So today we're going to be talking about the nursing process. The nursing process is a method used to care for patients. Each member of the patient's nursing team must work with the lead RN to carry out the nursing process. The nursing process has the following 5 steps. Step 1, assessment. Step 2, nursing diagnosis. Step 3, planning. Step 4, implementation. And step 5, evaluation. Step 1, assessment. Assessment consists of collecting information and communicating that information. So with collecting information, the nursing team collects information about the patient in several ways. These include a review of the medical record, taking a medical history, performing a physical exam, and observing the patient. So there's 2 types of observation, is objective observations and subjective observations. Objective observations, are what we call signs, can be measured or seen. For example, the patient may have a temperature reading of 102.5. Members of the nursing team uses their sense of sight, hearing, touch, and smell to collect this information. So with sight, healthcare workers may watch how the patient walks, notices unusual skin color, swelling, rashes, and sores on the patient's skin, unusual urine and stool color, abnormal quantities of food that have been eaten or left on a patient's plate. With hearing, healthcare workers may listen to respirations or a heartbeat, be alert for coughing, impaired or slurred speech, or unusual body sounds. With touch, healthcare workers may touch a patient's skin to determine whether it's hot or cold, perspired or dry, or feel whether a patient's abdomen is soft or firm. You may have to touch your patient in order to get a pulse. With smell, healthcare workers can detect unusual odors from the body, such as like breath, urine, stool, a funny smell coming from a wound, things of that nature. With subjective observations, which is the slide we're on now, subjective observations or symptoms are comments made by a patient or complaints made by the patient. The patient may offer information, for example, I have no appetite. Or a member of the nursing team asks a patient a question, for example, did you sleep well last night? The patient will state, no, this pain in my back has been waking me up again and again. Members of the nursing team may ask the patient questions after the patient offers information. In the sleep example, the nursing assistant will then ask the patient why he didn't sleep well. The patient answers, I have a lot of pain in my lower back. Those are subjective, meaning we can't gauge a patient's pain. We can't say a patient doesn't have an appetite, or maybe the patient isn't telling the truth about the level of pain that they're experiencing. So quite simply, subjective observation is what the patient says they're feeling. The second part of the assessment is communicating the information about the patient to other team members. Members of the nursing team may do this by documenting the information in the patient's medical record. Problems must be reported immediately. So, step 2, nursing diagnosis. After information about the patient is collected and shared throughout the nursing team, a nursing diagnosis is given. The nursing diagnosis involves these 2 parts: statement of the patient's problem or potential problem, and the cause of the problem. The following examples of nursing diagnoses: impaired physical mobility due to arthritis, dehydration due to diarrhea, or memory impairment due to dementia. Only RNs are able to make nursing diagnoses. LPNs and nursing assistants are not able to make nursing diagnoses. RN of the patient's nursing team is responsible for the patient's diagnosis. So step 3 is planning. A part of planning is creating a patient care plan, which includes nursing diagnoses, goals for the patient, and nursing interventions. The first part of the patient care plan is the nursing diagnosis. The second part of the patient care plan is goals for the patient. Enable the nursing team to know if the patient's problems have been resolved. Patient's nursing diagnosis is urinary incontinence due to weak bladder muscles. The goal for the patient is to have no episodes of urinary incontinence for 3 hours. The last part of the patient care plan is nursing interventions. Nursing interventions help the patient to reach the goals. For example, to reach the goals of having no episodes of urinary incontinence for 3 hours, the patient will do 10 sets of pelvic muscle exercises 3 times a day to strengthen the bladder muscles. Nursing interventions do not need a physician's order. For example, a nursing intervention cannot involve prescribing medication or performing surgery. The RN who leads the patient's nursing team assigns nursing interventions to the team members. Changes to interventions and goals. Changes may be needed to the patient care plan based on the patient's needs. Nursing interventions and goals may be changed because the patient is unable to achieve the desired level of ability or because the patient has achieved a new level of ability. For example, for the goal of having no episodes of urinary incontinence for 3 hours, the patient is not able to do 10 sets of pelvic muscle exercises 3 times a day. As a result, the nursing intervention changes to the patient doing 5 sets of pelvic muscle exercises 3 times a day. Changes may also be needed to the nursing diagnosis. Diagnosis may be changed because the patient reaches the goal or because a new problem develops. For example, if the patient reaches the goal of no longer having any episodes of urinary incontinence, or the patient falls due to osteoporosis, which requires goals and nursing interventions for a new diagnosis. If the patient reaches the goal of having no episodes of urinary incontinence for 3 hours, the goal changes for the patient to go longer without having any episodes of urinary incontinence. Patient care plan may be created during a conference. All of the members of the patient's nursing team should attend the patient's care conference. Other members of the patient's healthcare team, such as a physician, may also attend, and the patient and his or her family should also attend. The patient care plan may be modified during future care conferences. Step 4 is implementation. Step 4 of the nursing process is implementation. It is carrying out the nursing interventions listed in the patient care plan. This is when the nursing team provides care to the patient. So when we're actually putting those things into play and taking care of our patient. So step 5 of the nursing process is evaluation. Evaluation is determining whether the patient has reached their goals. If a goal has not been reached, the nursing team must determine why. Nursing interventions or even the nursing diagnosis may need to be changed. If a goal has been reached, the patient's problem has been resolved. In this case, the goal may be extended. For example, the patient reaches the goal of having no episodes of urinary incontinence for the 3 hours. As a result, the goal may be changed to the patient no longer having any episodes of urinary incontinence. So our last and final slide is the nursing process and the role of a nursing assistant. Assistants are important to the nursing process. They provide much of the care to the patient and are responsible for knowing what nursing interventions they are to carry out. Their most important task is to collect information through observing the patient's physical, mental, emotional, social, and spiritual conditions. Observations made by the nursing assistants are valuable to all 5 steps of the nursing process.